For a very long time, people in my community suffered and died from various diseases. We had to walk over 5 kilometers to reach a health center, where products and services were also expensive for us. My newborn baby suffered from malaria. I tried to do everything in my power to save my daughter's life. Those were tough times for our community.
Everyone has the right to have access to good and affordable health care, no matter where they live. But for more than 600 million people on the African continent, this is not the case.
It's not about intention of people, but it's a system that's not been able to operate at large scale. And I got more and more confused why Coca-Cola was actually distributed everywhere and all those life-saving drugs were not. And it was about the system, and that's where I created Health Entrepreneurs for.
More than 90% of all health issues can be handled at community level. We are creating a systematic change in healthcare provision by making it affordable and accessible to everyone through our unique business model. This is done by empowering people to take care of themselves and their communities. We do this through our community health entrepreneurs like Josephine.
A CHE is a professional provider of good and affordable health care. It is important that I respect my work and conduct myself professionally when dealing with my patients, ensuring that they learn about all available products from healthy entrepreneurs.
Health Entrepreneurs determines the right products to distribute to the customers by doing product surveys in the communities during different mobilization meetings, during different DHO visits, but also we use the health data that is available, and then we get into the market, get in touch with different suppliers that give us the most competitive prices in the market, give us good quality products, but also support our growth. The need in the communities is continuously growing.
Each CHE pays a commitment fee. This comes with 5 days of training and a smartphone which has Healthy Entrepreneurs applications installed. They are provided with a starter kit containing medical, nutritional, and preventive products which are offered on credit. They gradually pay back within several months.
The loan system is important for the CHEs because it majorly boosts their business to start up and immediately pick up with our system because they've already been trained and they have all the necessary knowledge that they need to start the business. So we give them this loan to push them, to empower them to start working immediately.
We focus on the last mile distribution model, which focuses on areas where there's at least a 5 kilometer walking distance to the nearest health facility, because that is where we make a difference.
The CHEs make regular orders through the call center or the product application on their phones. Each cluster has 15 to 20 entrepreneurs who each serve about 1,200 people. During the cluster meeting, they receive further training and they receive their orders.
We take products for them every 2 weeks, so the CHE is already stocked up. And once the products reach the CHE's home, the people in the community are saved a lot of costs. They're not going to use transport to move to the health center or to walk long distances because the CHE is just within their village.
The CHEs sell these essential products to patients in their communities with a profit margin. Every CHE is trained in basic healthcare. Since they are not medical experts, they receive assistance from a medical team at a distance.
So do you have any paracetamol tablets with you?
Telehealth consultation is vital in providing quality healthcare, especially for chronically ill patients like hypertension and diabetes. We monitor chronic patients, reduce cases of self-medication, and collect data. It cuts patients' traveling time and it saves 85% of the costs compared to visiting a health facility. The teledoctor registers all patients' vitals in the patient management system. As soon as the CHE scans the patient ID card, the e-prescription is received by the CHE on their smartphone and the treatment is ready to be handed over. Healthy Entrepreneurs meet the health needs of people in rural and remote areas of Africa by kickstarting new CHEs, expert service provision, and a unique sustainable supply chain.
watching this lady transform her life and the life of the people she's living with, even her own husband, is already something that makes me very passionate about this work. And I always transfer this same example to the rest of the CHE and also work towards transforming their lives and the lives of the people they are working with.
Bye-bye.
We are looking after our patients and everyone who works with us is part of the family to make sure that by 2030, more than 250,000 entrepreneurs active in more than 20 countries, serving more than 300 million people, which is an equivalent of the complete United States of America. And we also want to have third parties copying the model and actually start deploying the same. Because by making sure communities can look after their own health, we can guarantee that no one is left behind.